Hey, thanks for tuning in to the second part of Ralph Peterson's episode. If you love Sound Leadership with DJ as much as I do, please do us a favor. Hit that like, share, and subscribe to our social media platform. Now to the episode.
This morning, my wife is a school teacher.
And my wife's a teacher as well. Kudos to the teachers.
See that? And today was her last day, and so there's some phone calls home where kids didn't pass, and it's all the whole thing. And we were talking about her A students, and she says her A students are, they don't sweat anything. Like everything kind of comes pretty easily to them.
Yes.
But her B students, generally speaking, have to work pretty hard to maintain the B. So in order to be a B student, you have to both be interested in the subject enough to be motivated to work hard in it because you're not naturally gifted. That's what a B student is. There is the counter. You could say a B student is just a lazy A student, right? It's like somebody who's just skating along. You can have that argument.
Yes.
But as we were talking this morning, and I keep looking because I wrote it on my whiteboard this morning, I wrote this. I said, in management, you are either a B student or you are barely passing. So what I mean by that is simply, as a manager, you may get it. You may ace a test. Mm-hmm. Right? You may have a weekend or a situation where you come out, you did the right thing at the right time to the right person, A across the board, but that aggregated over time is not likely. In management, you have to both be very interested in being really good, i.e. effective as a manager, mm-hmm. and you're so interested that you're motivated enough to work at it. And that is a B student. If you are not a B student, then you're barely even a manager. You're reactive. You're a C student at best, right? Like you're getting your paperwork done the night before or on the way to the car. You know what I mean? Like you don't get a report done ever. You're filling out your 2567, which for those who don't know, when you have a state survey and you get a bad state survey and you have to write a plan of correction, it's called 2567. You have 30 days to write it. I cannot tell you how many times I've seen people in their office at 8 o'clock on the night it's due.
Oh, listen.
Right in the 2567. And that's a C student. That's somebody barely hanging on to the idea of management. Barely hanging on, barely passing.
Wow. I like that analogy, right? And I can relate to it because as I stated, my wife's a teacher as well, so I understand the analogy more than some. My wife's been doing this for a while, so I get it. And, that's what's interesting about leadership, right, is you have various different facets of leaders. And, I like to break it down a little deeper because you're focusing, to this point has been managers. People have to understand there's differences. And we talked about this on Kelsey's episode, so if you haven't seen that, go see that one. There is the line staff. Then you have a supervisor, kind of first entry into management. Then you have a manager, right? Then you have a director, right? And then you have the CEO, the executive, right? And there's different layers to them, right? Supervisors, you're just that, right? You're supervising, right? You're just overseeing. You're one step above your friends. Yesterday you was a friend, and today you're a supervisor. They gave you a vest and a whistle. That's what you're doing. Then it's the manager, right? You're overseeing the people with the vest and the whistle, and you get the office now. But your job is to just carry out the vision. Your job is to really be that enforcer, right? And then there's the director, right? You help to start kind of shape the vision, but you're really pushing the vision. You have some insights. You might attend one or two executive meetings, but you're not in there with the key stakeholders. And then there's the CEO, the COO, the people who are the visionaries, the people who are really charting that strategic course. And I think people have to understand there's different levels of leadership, and that was what I was pointing out. So, to your point, when you talk about the BC students, right? I think it depends on what level of leadership you're in, right? Whether you're that supervisor, whether you're that CEO, right? I think that what impacts how we view the organization and how we view the culture, right? Because who I am today as a CEO, as a COO, or consultant is different than who I was at 19 as a team leader of a group home. I just had a whistle and a reflective vest, right? But now as a CEO, I can help charter courses. I can help set that strategic vision, and I can help move the organization forward. Um, how can you, as a leader or as a CEO or somebody who's in that seat, right, ensure that your vision, your strategic vision, is being implemented and being seen across the board? How can you ensure that as a leader?
Well, that's a
I come
great
with the
question.
questions, man. I
Yeah,
come with them.
it's quite easy or quite simple and not easy. You know what I mean? Like it's a simple in theory, and I would just simply say start with what it is that you want to accomplish and make that super easy and transparent. Reduce the amount of words to three. One would be best, right? Like what are we doing? Like the three words that outline your exact intent for this organization, and then figure out how to communicate that to everybody and measure that communication. Don't just simply say we put it in the newsletter. The question is who's reading the newsletter? How do
Yeah,
you know people are reading the newsletter? How can you
yeah,
measure, right? Like, and there are a lot of, I know an administrator who is a huge fan of the Grinch. He had like this big toy chest in his office and everything was
yeah.
in the Grinch. Like you name it, stuffed dolls, pencils, Rubik's cubes, like shirts,
Wow.
everything with a Grinch on it. And he would play these games where he would give out stuff. You could come into his office and pick something out of his
Hmm.
chest for the Grinch. And he had a great way of making sure his staff read his weekly newsletter. He put out a weekly staff newsletter. And somewhere in the newsletter, not every week, but somewhere in the newsletter, it
Yeah.
would say, at Wednesday at 3 o'clock, the first four people who come to my office can take whatever they want out of the chest.
Yes.
Now, if nobody shows up at 3 o'clock on Wednesday, guess
Right.
what?
Yeah.
Nobody's reading the newsletter, right?
Yeah.
And so he's got to go, okay, all right, right? So, but that's just a way of measuring. That's a way of
Yeah.
engaging. It's not enough to create your vision. It's not enough to reduce it down to 2 or 3 words. It's not enough to then communicate it, put it, it's on the website, it's in the bulletin board, it's at the time clock, it's in the bathroom, it's posted in the front lobby. That's not enough. The next thing is you have to be able to measure it's working. How do you know people are seeing it? That's the important part.
Wow. And I want to segue a little bit because now you're diving into what I love. Action.
All of this is what I
Data.
thought we were.
Even more, right? Measurement and data. So, you are the CEO of a company, the Core 14, and I think it focuses on quality. And if for people that don't know, I love quality, right? Certified in QAPI. One of my masters is in
I
data
saw that you
analytics.
just got certified in coffee.
Yes, yes,
Congratulations,
yes.
by the way.
Thank you. I appreciate it. Like I was saying, my one master's in data, right? So I love data, and not everybody can read and interpret the data. So tell us about your organization, how you help companies move it forward, and what data and quality means to you.
Yeah, thank you for that. So the Core 14, actually, so let me back up. I got involved in the Quality Award program way back in 2012 with a friend of mine, an administrator named Sandy Sarza. She was volunteering for the Quality Award program through the American Healthcare Association. And she said, you would love it. It would be really great. And I was like, but I'm not a nursing home administrator. I work in senior care, but I'm not an administrator. She was like, you don't have to be. And so she invited me to apply and I did, and I fell in love with it. It's such an amazing program. And it's where nursing homes and assisted living facilities are able to apply for an award. And there's 3 levels of the award. The first is the bronze. The bronze is a commitment to quality. So you're demonstrating that you're committed to quality, which simply means from a leadership point of view, you're committed to making decisions proactively based on the data you're getting back, the feedback you're getting back from your quality measures, as opposed to being reactionary. That's step 1. And then the silver is where you're demonstrating, you're actually proving, you have real proof that you are indeed managing proactively through quality, through the lens of quality. And then the gold, which is the highest standard in senior care, that is the mastery level. That means you are masters at leading through quality. And I mean, before we started the show, I was telling you a little bit about my Navy Marine Corps Achievement Medal that I received from the Marine Corps because I was the admin chief of a regimental aid station. And we had a command general readiness inspection, what they call a CGRI. And our shop was the only one who passed. And we were the only ones that were ready and deployable after 9/11. So I was in the Marine Corps during 9/11, and they came through, and the command general readiness inspection team came through, and they wanted to see who's deployable, who's ready to just go. And we were the only ones. And I got a medal for it, which is really great. But my point is simply that I fell in love with processes and putting your ducks in a row and the list and making sure this meets this. And that's kind of how I fell into it. And the name, the Core 14, one of the biggest, most important things that you can do as an organization when you start anything based on quality is the first thing you should do is identify what your values are. As an organization, like, what do you stand for? What is important to you? And that's why I named my company the Core 14, because I'm a third generation Marine. My grandfather was a Marine. My dad was a Marine. I'm a Marine. And I grew up with the knowledge of the 14 character traits of the United States Marine Corps. And they're literally the values of the Marine Corps that I hold dear. Wow. And so that's why I named my company the Core 14, after the Core 14 values that I grew up with. Wow. In the Marine Corps. And so now my whole job, and I have the best job in the entire universe, is I work with senior care organizations that want to win quality awards.
Nice.
And you know what they're willing to do to win a quality award? They're willing to focus on quality. I mean,
yes.
What an amazing, mind-blowing. Yeah. By the way, I should put this out there. If you have a loved one, or if you yourself are looking for senior care and you're like, I don't know where to begin to look, go to ahcancal.org, go to their website, go to the tab that says quality, go all the way to the bottom of the page, it says quality, click on that. Then it says quality award winners. Click on that. And whoever won a quality award, that's where you should stay.
Wow. So
that's better than the CMS website. That's a better indicator than the star rating. Trust me. If they've won a quality award, especially silver and gold, that's where you want to stay. You want to be taken care of by people who put quality outcomes first.
And for what it's worth, a lot of leaders have problems identifying quality measures, right? What are quality measures? What do we do with the quality measures? How do we interpret the data, right? I'm going to throw some terms out there, and it's just basic terms, but let's talk about them. We talk about the 5 whys, the fish bones, the PDSA cycle, right? All that goes hand in hand with the QAPI. And I tell people, right, there's a difference between QA and PI. We smash them together. But QA and PI are not the same.
No.
They are not the same.
No. Actually, the whole idea of PDSA, Plan, Do, Study, Act, all that is, the only thing that a root cause analysis, a fishbone analysis, PDSA, a DMAIC, all these acronyms, initials, whatever, all it is just a process for solving problems. So the question is, how do you systematically solve a problem? And in healthcare, we have processes that are very specific. So the first thing we do is we measure. So let's say that we're measuring unplanned weight loss. Unplanned weight loss is when a resident is losing weight and you have no idea why, because they don't mean that we're not intending them to lose weight. But it's clear that if they're losing weight, there's something going on. They may not be eating, whatever, something's going on. So you find people who have unplanned weight loss. The only way you're going to be able to find that or identify it is if you are tracking. And the only reason why you would track unplanned weight loss is because it'd be one of those things that you've identified that is important to you and your customers. unplanned weight loss, urinary tract infections, UTIs, skin breakdown, falls, a decrease in ADLs or activities of daily living, like all of the things that we deem important for our residents. You're tracking them. And then once you find an issue, like, hey, we're going in the wrong direction here. We're trending. We're having more falls than we're supposed to. Or we're having more unplanned weight loss. Then we'd want to stop and go, okay, let's look into this. And the first thing we do is a root cause analysis, which is where we get the 5 whys, because you're trying to figure out, why is it happening? Where is it happening? When is it happening? Right? Like you're just going, why is it happening? And hopefully it's going to reveal itself. Maybe there's some options, and then you come up with a plan. And then you do the plan, and then you study, is the plan working or not? And then you make a decision based on the results of that plan. And that is a PDSA. So that whole process is not just QAPI, but that is literally how you solve problems. Even if you don't have that in your head, like step 1, step 2, step 3, step 4, trust me, everybody goes through that mentally. We in healthcare, it's just important to have it like legitimately written down.
Yes.
So that we all follow it.
I love that. I mean, I'm just so fascinated because data tells us so much. I mean, it's there, but so many leaders run away from it. I help nursing homes move it forward, and I always go to, well, what does your policy say? Let's start with the policy. Right?
Let's start there.
Let's start with what should we be doing, and let's compare it to what we're actually doing. Right? We got to start somewhere. So let's start with what you're going to give the state. And when I do that, I say, okay, so are you holding these meetings? Are you doing this right? And are you copying what you need to copy? See, not everything needs to be a copy. Some things are JDI, just do it, right? We just need to fix it, right? So, but there are some things, like you say, we have to really dive into why there's a lot of UTIs. You mentioned the unplanned weight loss, right? I know as an administrator, as a healthcare consultant, that anything above 5% of my facility, I need to copy that. I really need to dive into it because now we have some issues going on, right? And we need to dive into the whys, right? Is it, lack of staff? Is it a lack of portion control in the kitchen, right? Is it a lack of dietary accommodations, right? There's so many reasons, but when we start talking about the why, right, that's diving into it, and you're tapping into any and everything you can be to try to figure it out and then correct that. But then from there, you test your theory and then reevaluate your theory, right? It's not just we put it out there and say, oh, we fixed it, time to go home. No, is it correct? Did it work? And that's what leadership is, right? We have to be able to thoroughly evaluate what we put in place, and for others to follow us, we have to know what we're doing. So we have to be able to reach out and say, hey, we don't understand it, right? A lot of leaders they fail to reach out and say, I don't understand something, because we're the leader, we have to know it all. But I always say, surround yourself with people who are smarter than you. You have to. You don't know it all as a leader.
Yeah, 1,000,000%. And it's interesting, so for us, I work with a bunch of homes, helping them with their QAPI, and we take it one step further. So the quality assurance part is where you're measuring all your quality outcomes. And as a tip, you always want 3 data points at least, so that we can trend. We can see, are we going up or are we going down? So always start with 3. Go back 3 months, 3 weeks, 3 quarters, 3 years, whatever.
Yes.
So you can see which way you're trending. But then the other part is that performance improvement part. We are really, really big at evaluating and improving our processes. And you name the process. I mean, admissions process, discharge process, hiring process, delivering food process, bathing process, AM care process, HS care process, like all the healthcare processes, we are very interested in evaluating and improving every single month. So throughout the year, we've identified 12 work processes that are important to us, 12 key job routines that are important to us, and we add those to our QAPI. So not only do we have our data from our quality measures, which is our pain, breakdowns, tears, falls, all that kind of stuff. In addition to that, for our QAPI, we're also looking at job routines. We're also looking at work processes. We are constantly interested in how to evaluate and improve everything. That is really, really impactful. I can't tell you how many times we're in a room with all the department heads, and one person is presenting on how some job goes. Like, this is how we run the tray line.
Yeah.
Or this is, and this is one of the things that we identified with a late admit on a Friday. A late admit on a Friday is a nightmare for the kitchen because it's not until Mondays are they actually added into the system. And I remember the MDS clerk, sitting in the meeting with us, and he's just listening to the dietary talk about what it's like to get a late admit on a Friday night and with a brown bag dinner for them because they didn't get a meal ticket, or sometimes it's after the meal has already been done. And so then they'll come in and, breakfast, boom, guess what? They're not on the meal ticket. So they have to get, so imagine being that resident. You're getting a brown bag lunch or dinner the night you're there on Friday night. On Saturday morning, your breakfast isn't there. They have to call down for it after everybody else's trays already been gotten. So you're eating less. I mean, think about how you feel about this home so far, right? Then lunch comes. Guess what? You're in the dining room. Everybody's eating. They have to call down again for your tray because you're chicken. And so all this, and it happens all weekend. And the MDS clerk, this guy is sitting in the back, goes, the first thing I do when I come in on Mondays is I evaluate all the late admittance, and I'm the one who adds them. And we're like, wait a minute. We never would have known that MDS had an approval mechanism that delayed the kitchen or the meal ticket to be printed on. And then once we started to talk and get it out, they were able to solve the problem. So no longer is there a late admit coming in on Friday and they don't have breakfast waiting for them on Saturday morning. And it only happened, we only solved it because we will take work processes and the idea of evaluating and improving them. That's the performance improvement part of QAPI seriously. And we do it on a monthly basis.
And we can, I can tell you're passionate about the data.
I'm passionate about everything.
Of all. So we're going to have to do a podcast just on QAPI. But as we bring this to the end, what tips can you give an aspiring leader who wants to throw their hat in the ring and become a leader? What tips would you leave them with?
I will tell you, I'll say two things. Number one, if you're even considering being in charge, do it. Do it. It is the greatest job in the entire universe. I can't speak highly enough for the job. The second thing that I'm going to say is that you've got to be your own advocate. One of the biggest challenges that I faced as a new manager is I always thought everybody thought I knew everything and didn't need any assistance. And I was always embarrassed to ask for help. And so I didn't ask for help. And then I would get terminated because I wasn't doing things properly because I didn't have any help. And they thought I knew what I was doing. I clearly didn't. When I'm talking to managers, especially administrators and DONs, who are the two key people in senior care organizations who are in charge of developing staff, they're in charge. Forget staff development. I know you're like, oh, we have a staff development clerk. Forget your staff development clerk. The two people in charge for promoting and training and cultivating leaders in senior care organizations is the DON and the administrator, and they should be doing it together as a team. It only takes 5 minutes a day. 5 minutes a day to be an amazing, brilliant mentor to your upcoming, rising through the ranks employees. 5 minutes a day. And you're like, 5 minutes, that's nothing. But it has to be every single day. It can't be, 5 minutes on Monday, but then I'm too busy on Tuesday and Wednesday, so man, I'm going to try to give you 5 minutes on Friday. That doesn't work, friends. It's 5 minutes every single day. It's the consistency part that is key. And I don't mean on weekends when they're not working. I just mean when they are working. But because too many administrators and DONs do not take the 5 minutes a day. Again, you're asking me for advice to a brand new manager. My advice is you must demand your 5 minutes a day. That means every day you're going to go see the administrator, the DON, or both, whatever, and you're going to say, can I have a few minutes? I just want to talk to you about how I'm doing. Or, this was happening earlier and I wasn't sure what to do, so I did this, but what would you have done? Always hat in hand. Always. I always go in and I have this story where I had an administrator who was also the owner of the nursing home. So he was the administrator is the owner. And I could never do anything right. everything that I did, he totally argued with. He's like, well, you shouldn't have done that, and you should have done it this way, and you should have done it that way. And at first, I was kind of like really flustered. Like, I didn't even know what to do. Like, I almost wanted to no longer make decisions. You know, like, I mean, honestly, if you just want to do it yourself, just do it yourself. But then somebody gave me some great advice. They said, if he were my boss and he was the owner of the organization, what I would do is I would always just run it by him. Just be like, hey, this is what's going on. And I was thinking about doing this, but I'd love to know how you think, how you would handle it. And once I started doing that, like swallowed my pride, just going, hey, can I talk to you for a minute? His name was Tom. He was a really good guy. I was like, hey, Tom, can I talk to you for a minute? He's like, what's going on? I'm like, well, I have this issue with one of the employees and this. And he's like, okay. Like, I'm just curious, like, you know, what would you do? Like, how do you think is going to be the most effective? And it was an amazing transformation because all of a sudden, without even realizing it, I tapped into what he loves. And it's the same thing that I love. And that is I love to teach. And so did he. He loved to have the opportunity to go, let me tell you what happened. Because the truth is, as I was saying earlier, if you want to be a good managers are B students. What that means is we're always trying, but we're not always successful. Because, you know, I mean, I could pat you on the back today and then tomorrow go to pat that same person on the back and it not work.
Mm-hmm.
Right? Like, because people change, attitudes change, days change, the weather changes. Management is this fluid, trying to figure out how to take care of our customers the best we can with the resources and people that we have. And by the way, that's the focus. My focus is never on, I want to be a good manager to my employees. I never think that way. I want to be a good manager for my customers, which forces me to be a good manager to my employees. But my employees are not my focus. My customers are my focus. And by the way, and I keep saying, by the way, customers are the only ones who can tell managers if they're any good. The only one who can tell if you're any good as a manager is the person who's using your product or using your service. They're the only ones who have a clear view of whether or not you're a good manager or not. Not your employees, not your mom, not your wife, not your kids.
I do that.
Not your boss. None of them matter. Yeah. The customer is the only one that matters.
Wow. Wow. Well,
I'm exhausted. I got to go.
Wow. I thank you for your insights. And I thank you for just sharing with us, right? This is going to be a two-part episode, or this is a two-part episode, and this will be the ending of the second part of our episode. And I just thank you for sharing your thoughts, your insights with us, the viewers, you know, with myself, right? I just thank you because you brought your authentic self to the podcast, and we got to learn a lot from you, right? And I appreciate you taking time out of your day to share that with us. So, you know, thank you for joining us here on Sound Leadership with DJ. We hope you gain valuable insights and inspirations from our conversation with Ralph. If you've enjoyed this episode, we encourage you to like and follow our social media pages for more great content. You can follow us again on YouTube and LinkedIn at Sound Leadership with DJ. But don't forget, we're in the pocket, we're in your car, we're on your favorite platforms, including Apple Music, Alexa, iHeart, and so many more. Simply search Sound Leadership with DJ and hit that subscribe button to stay up to date on the latest episodes. What I want you to remember is, this is important. Leadership is a journey. It is not a destination. Keep striving to learn and grow and never give up on your goals. Wish you all the best on your leadership journey. And we look forward to having you join us again soon for more insightful discussions on Sound Leadership with DJ.